Hello everyone, I am Ishan Erandika Jayashanthe from group number 26. Today I am going to talk about the transferring a patient on a stretcher under the topic patient's mobility transfer skills and ambulation, measuring and recording vital signs. Uh, Tips for moving patients from a bed to a stretcher. Moving a patient from a bed to a stretcher must be carefully conducted to ensure the patient remains comfortable and uninjured throughout the process. It is never recommended to move a patient on your own. A team of two or more people is needed to keep the patient and transporters safe. You don't want to pull out your back in the process. When moving a patient from a bed to a stretcher, there should always be a leader. Uh, there should always be a leader tasked with pulling the patient and a helper who is tasked with holding the draw sheet. The leader should be the strongest of the two people conducting the task. The holder must hold down the uh, draw sheet careful not to pull or lift the sheet, but simply hold it in place. If three people are on the task, an additional person can assist by holding the patient's head and neck through the transfer. Uh, if the patient is over 200 pounds, you will need additional assistance and possibly even a mechanical transfer device. Then we can talk about the four steps to safely move a patient from their bed to a stretcher. Step 1. Get ready to move the patient. Before you move the patient, it's important to get everything in place and ready to go. Start by lowering the head of the bed down and adjusting the bed height. In addition, make sure the bed wheels are locked in place. Use a plastic side. Uh, Use a plastic slide board or garbage bag to slide under the sheet and draw sheet, wedging it beneath the patient's torso. Shift the patient's legs so that they are close to the edge of the bed. Have the patient cross their arms over their chest and then describe uh, how you can how you plan to move the patient so that they can work in unison with you and know what's going on each step of the way. Step 2. uh, Slide patient to edge of bed. Have the helper grab onto the draw sheet on both sides of the bed. Count three, then lean back so that your weight shifts to your heels, at which point the leader can slide the patient towards the edge of the bed. All the while, the helper continues to hold the sheet so that it doesn't slip out place. Step 3. Get the stretcher position and ready. The helper will cradle the patient in the draw sheet while the leader grabs the stretcher. The goal is to have the bed slightly higher than the stretcher. When ready, position the stretcher beside the bed and lock the wheels in place. Start by moving the patient legs onto stretcher. By first moving the patient's leg, you can decrease stress on your back considerably. And the last step is slide patient onto the stretcher. The helper can kneel on the bed while still holding fast to the draw sheet. Grab onto the draw sheet and count to three before sliding the patient onto the stretcher. You may need to do this a couple of times a couple of times before the patient is fully on this stretcher. Thank you.